Hi, everyone. Welcome to Ivy League. We are going to have B. Braun sponsor today's event, and I'm going to go ahead and turn it over to Dr. Kristen Jacobs so she can introduce our speaker.
Thanks, Tony. And welcome to everyone tonight. And we are so fortunate to have Darcy Dolman join us tonight. Um, I don't want to say you're a big deal, Darcy, but
Whatever.
maybe you're a big deal.
Not really.
But Darcy is the Associate Director of Healthcare Strategy and Innovation for B. Braun. But before doing that, she has been the past president of AVA. She's widely published and assisted with the Infusion Nurses Society standards. So welcome to Darcy to come talk to us today about getting sticky with it with peripheral IVs.
Well, thank you, Kristen, and welcome everybody. Today's topic is talking about peripheral IV catheters and data-driven practices for care and maintenance. We're also doing some virtual rounding. So let's get sticky with it and get started. This is my disclaimer, being an employee of B. Braun Medical. And looking at the current state of peripheral IVs. If we look at PIVC education for nursing students, it's really lacking. Only 57% of nursing students receive PIVC education. And looking in the clinical arena, 69% of peripheral IVs fail before treatment's complete, which means this is repeated sticks for many patients. And then the complication costs are very staggering, around 121,000 annually. This is at a 250-bed hospital. And looking at the average cost of an IV insertion in the US, it's somewhere around $28 to $35. And this is really based on like the nursing time and actual supplies. So knowing about the cost and then looking at the patient satisfaction, we're really focusing on that first stick success rate. So in a possible solution is the Peripheral Advantage Program. This is a comprehensive program. It helps deliver safe and consistent PIVC care. The Peripheral Advantage Program has 5 focus areas: the actual education curriculum, technology to visualize veins, the appropriate device selection, which is really important. So we're putting it in the right vein. And then also the PIVC care. So we're discussing the securement and also the PIVC maintenance, and then the data and analytics. We're going to actually do rounding on some virtual patients. So this is the fun part of this. And one of the things that's important is really looking at obtaining some baseline data so that we can really track process. So rounding, I'm using a database called CAIU. And for time's sakes, we're looking at 4 key areas. We're going to look at the PIVC location, looking at the IV site, is it visible? Looking to see in case there's any visible complications. And then looking at the dressing, is it clean, dry, and intact? So this is our first patient, patient number 1. Let's look here at the location. Where is it at? It's here on the wrist. Is the site visible? Well, no, not really, because there's blood at the site. Is it without any visible complications? No, because bleeding at the site's a complication. And the last question, which is very obvious, is it clean, dry, and intact? No, it is not. Our second patient here has an IV. It's located in the wrist, the hand area. Is the site visible? Absolutely not. That last piece of tape is covering the patient's IV site. Is the site without visible complications? No, because we can't really see the patient's site. And is it clean, dry, intact? No, I think this was a very interesting type of tape just for this patient. Our third patient, the actual location's in the AC, the antecubital fossa. Is it visible? Not really, because the border tape is covering it up. Is it without visible complications? No, because there's some drainage at the site. And is the dressing clean, dry, intact? Absolutely not. Looks like some arts and crafts here, putting the actual dressing on all different ways. And then our fourth patient, we're going to look here at the actual location. The location again is the AC. Is it visible? Nope, there's blood there at the site. Is it without complications? No, because again of the bleeding. Is it clean, dry, and intact? Absolutely not. Our last patient, the location's in the forearm, which is a preferred site, especially with using ultrasound. Is the site visible? It certainly is. Is it without any visible complications? Yes, it is. Is it clean, dry, and intact? Yes, it is. So this is the type of dressings we like to see at hospitals, especially during rounding. And then also too, let's look here at our results for the rounding. How did we do? So for the PIVC location, our data showed we had two patients in the AC, one here in the wrist, which both of those areas are higher risk because of the flexion. We had one in the forearm and one in the hand. Is the site visible? You can see the majority is not visible at all. About 3/4 of it was not visible. 4 out of 5. What about any visible complications? Around 3/4 did not, or actually had complications. And then is it clean, dry, and intact? You can see only one patient had really a dressing that's clean, dry, and intact, and that's number 5. So really, in looking at the data, it doesn't really lie. And sometimes with looking at data, it gives us opportunities for really looking at education on PIVC practices, products, bedside support, and then over time, really looking at patients again and actually rounding to be tracking and trending data. This is from the infusion standards, and this is with the vascular access device securement, the ASD. And the ASD, it's applied at the patient's skin, has a mechanism, and it holds the catheter in place. Adhesive securement device is ASD. The integrated securement device, or ISD, is really a combination of a dressing and actual securement. The features are, it has a transparent semi-permeable window, has a bordered frame collar, and then built-in securement technology. And looking at the evidence behind securement, this is a study by Victor Lang. This is a poster from AVA 2023. And what Victor Lang did is that he actually compared the StatLock IV Plus securement device and then the ClickFix peripheral securement device. And his purpose was really looking at the product performance, looking at micromotion at the site, were there decreased complications, and then looking at the satisfaction, the staff satisfaction for the application removal of it too, which is really key too in looking at products. Here's Victor Lang's results. 311 patients had the actual devices. You can see here with the ClickFix, there was 0 catheter dislodgements with the ClickFix catheter securement device, 0 cases of phlebitis, and then 0 reports of loose dressings. So that's really important for us in looking at outcomes for our peripheral IV catheters. And this is a ClickFix peripheral catheter securement device. This is looking at it up close. This is the ISD, and this is really recommended by the INS standards for ISD. This has the key features of it: the transparent semi-permeable membrane, it's got the bordered fabric collar, and then the built-in securement technology. So this actually meets the INS standards for securement devices. And securement devices, they do make differences for patient outcomes, but they're not all created equal. And this is really to summarize my presentation on catheter securement and looking at the Peripheral Advantage program. This is a educational program. It's looking at optimizing patient care and outcomes, looking at product performance, and also patient outcomes and patient satisfactions. And I think this is an important piece for us in looking at our patients, whether they're inpatient or any outpatients too, that we're looking at our peripheral IVs, and we're really doing the best care possible for us. So what I want to do now is open it up for any type of questions that anybody might have on this presentation.
Thank you so much, Darcy. If anybody wants to put their camera, put their mic on and ask any questions or make any comments, or you're welcome to type it in the chat and we'll read them out for her. Now, the Peripheral Advantage program aligns with the PIV curriculum, correct?
Yes, yes. So this is the educational modules, e-learning modules. There's also some classroom training, and then there's bedside support for peripheral IV insertion. It also talks about the care and also maintenance and complications for peripheral IVs.
It does a lot of data collection as you go.
Yeah.
Mhm.
And this is the important part for the actual rounding. So for the rounding piece of that, you know, you're really looking at the patients. There's many other pieces too that we're looking at, from the fluids, the pump, are the tubings marked, and then looking at the actual dressing too. So there's many different features of it that we are looking at for the Peripheral Advantage program.
Anybody have questions or comments or want to talk to Darcy? Darcy has specialized in pediatrics and NICU for a very, very long time.
Yes. Over 3
We're lucky to have
decades.
such a great clinical expert.
Does anybody have any experience with the Peripheral Advantage program or any of the products in their facilities?
We
Do we
have a
know?
quiet group tonight,
I
Tony.
know, I know. Do we know how many facilities are using the Peripheral Advantage program?
Yeah, I'm not sure of the actual number of facilities, but I think it's very popular, not just because of knowing about the nursing schools aren't giving the education. It's just very limited. And so this is a great thing too, just with having the nursing schools having access to looking at the fundamentals of peripheral IV care and also insertion. So that's a really very helpful also too, when we think about a newer nurse entering any hospital too, that they have some baseline education just on PIVCs.
I have a question. I
Yeah.
think I agree that I think we all agree that the education for vascular access is lacking in the nursing school. And I am trying very hard to get my staff at the hospital that I work to be more knowledgeable about it. And we are offering PIV insertion classes. They're not very popular. And I would like to know if this would be something that I would be able to use, or would you be able to assist with that?
Yes, I think that this program is probably very helpful because there's some modules then just so that that newer nurse can really be looking at those modules. There's all different processes to it, or different modules to it, from device planning, the insertion, care and maintenance, the complications. And this is all evidence-based information. So this makes it really, I think that ease of use is a lot easier just for looking at the modules and then doing some hands-on, so that they're looking at a model of veins, and that they're actually doing a catheter placement. They're taping it, they're securing it. They can go over the actual assessment of it. So that also is very helpful, so that they're getting the education, the hands-on, and then really looking at that follow-up, doing rounding, because that rounding really gives us that data to really be looking at our performance of looking at PIVCs. And I definitely realize that hospitals, gosh, it's so busy on many units. But this is an important piece because majority of patients have some type of vascular access device, and it's most likely a peripheral IV.
Right.
So I'm gonna go ahead and drop in the chat for anybody who wants it. This is the web page where you can go and request additional information for both the Peripheral Advantage program and the PIV curriculum. So whether you're working at a hospital or working with a university, and actually I think I just sent it directly to Sheila. Let me fix that. So that you can enter your information, and then if it's for the PIV curriculum in a university, I will reach out to you. And if it's for the B-Braun Peripheral Advantage, then someone from B-Braun will reach out to you. But go ahead and fill out that form if you have an interest for your facilities.
Thank you, Tony.
Of course.
Yeah. Wonderful. And anybody else have any questions? No, no. Everybody's incognito tonight except for Sheila and James.
Carolyn and Carolyn. We have two Carolyns today.
Yeah. All right.
Okay, then I guess we'll wrap this up for the evening. Thank you so much, Darcy, and
Sure.
to B-Braun, I can't speak, B-Braun. And we look forward to seeing everybody in 2 weeks or seeing you at the conference.